Our next speaker for today is our beacon of hope for pushing evidence-based and scientific drug policies in the Philippines. And also our beacon of hope in terms of the funny memes in Facebook. Dr. Benjamin Reyes, or Doc Bench, has dedicated his career on public health service. He's a permanent member of the Dangerous Drugs Board and the chairman of the Drug Demand Reduction Committee. So his career in public service spans decades, serving not only in the DDB, but also in the Department of Health and the National Center for Health Promotion. Dr. Bench received his Doctor of Dental Medicine and Master's in Public Health from the University of the Philippines. He also received his Master's in Development Management from the Asian Institute of Management. Doc Bench, the floor is yours.
Thank you, Lee. Noemi is a tough act to follow. No, I've learned a lot from her, even in our discussions backstage. And I don't have a PowerPoint presentation, but my talk will focus on the rationale, the story behind the framework, and how we arrived at our current policies, no? The Philippine policies on dangerous drugs. So let me start by mentioning that as early as 1972, the Philippines already adopted a law, no, Republic Act 6425, or the Comprehensive Dangerous Drugs Act of 1972, which essentially created the Dangerous Drugs Board, which was then under the ambit of the Department of Health, and provided for institutional mechanisms for the implementation of the 1961 and the 1972 UN Conventions on Narcotics and Substances. No? So basically, our general framework at the time involves two broad categories, no? The reduction of supply and the reduction of demand. And in 2002, because of the emergence of new psychoactive substances and increasing methamphetamine problem at the time, no, in the Philippines, in 1992, methamphetamine became the number one substance of choice in the Philippines. No? So we had to adjust our policies. And because of the promulgation of the 1988 UN Convention against illicit traffic of narcotic and psychotropic substance, the 1972 law was replaced by Republic Act 9165, known as the Comprehensive Dangerous Drugs Act of 2002, which created our Philippine Drug Enforcement Agency, no, and reactivated a new Dangerous Drugs Board as the lead policymaking body composed of cabinet-level officials. Before then, they were technocrats. No? The members of the board were technocrats. But this time, the new law mandates that cabinet-level officials be the ones representing each agency. Now, the newly convened Dangerous Drugs Board drafted the National Anti-Drug Plan of Action during the time of President Gloria Macapagal Arroyo, no, during her first term after EDSA 2, which also transferred treatment and rehab programs under the Department of Health. So even then, we were already cognizant that addiction is a health issue. No, so we're starting to shift, no, to a more health approach. This includes prevention reintegration programs under social development agencies. At the time, there was a glimmer of hope, no, with the new law and the new anti-drug framework plan. We were hoping that we will be able to adequately address the drug issue. And later, the National Anti-Drug Plan of Action became the National Anti-Drug Program of Action, no, as opposed to a plan, just a simple plan. So this happened under President GMA's second term na, no, when she was re-elected. The latter was then revised and updated during President Noynoy's Aquino's time, no, when he issued an admin which updated all the targets, the strategies that we adopted in the National Drug Program of Action. Now, each of those revisions presented a glimmer of hope, no, that somehow this is it, that the framework document will help us address the drug problem with confidence, no? However, unfortunately, we experience new psychoactive substances coming in. We now have 4 drug syndicates, 3 international drug syndicates operating in the country. No, and we have also our local syndicates. No, and so I think that's the reason behind the current administration's trust and prioritization of this particular concern. And in all honesty, Lee, and to our audience, no, in all honesty, never was the drug strategic framework given more importance than during the current administration. I've been with government for more than 26 years, no, in this drug campaign, and this is the first time I really felt that it is a priority of government. No? So the administration approved and adopted the Philippine Anti-Illegal Drug Strategy through Executive Order number 66. And finally, as program implementers at the time, we were given sufficient allocation, no, for it to be, for our targets and objectives to be accomplished. Now, as early as 2016, we already recognized that treatment programs must be expanded to go beyond facility-based outpatient and inpatient programs. And you must remember that prior to 2016, we only have 2 programs, no? The inpatient and outpatient facility-based programs. And now, we now realize that we also need to consider the early stages of drug use, no? So as early as 2017, a new patient process flow was adopted with the help of UNODC and WHO, which included the provision of general and based interventions. The patient process flow was later improved, no, to streamline screening process, which will be implemented by the Anti-Drug Abuse Council, the local government units nationwide, through the respective health offices. Now, this was done through Board Regulation number 7, 2019. The patient process flow intends to provide a treatment framework that recognizes the various levels of drug use behaviors, no, and risk levels. And so we need to provide services depending on the need of the client. No, the framework is a step forward from the previous practice of providing services only for those with severe use disorders and are willing and are compelled, no, to be institutionalized for at least 6 months. So before talagang they are required to first decide on stopping the use, no, before they can be admitted in these facilities. So it is also provided in the law for now. So we're still moving for some amendments of the current law. So to date, we have more than 700, or almost 800 cities and municipalities out of the 1,634 cities and municipalities nationwide who have been implementing their own community-based programs nationwide. And as I was saying earlier, backstage, no, to Noemi, except for the needles exchange program, our policies are starting to align with current harm reduction principles. In fact, our Philippine Drug Enforcement Agency always mentions about harm reduction activities. Likewise, the initiative on plea bargaining is also a step forward in recognizing that drug use must be addressed by providing treatment rather than immediate incarceration. And all of these things we've done in the span of a few years. Of course, after almost 20 years implementing the current law, amendments are now on the table in both houses of Congress to push for in the field of addiction. Unfortunately, new challenges emerged. COVID happened. No? We had to adjust to new ways of doing things. We all need to rethink how we do things and accomplish our targets. But despite the pandemic, let me just assure everyone that the anti-drug campaign remains to be of vital significance that we always need to put at the back of our minds. Our current framework, if implemented properly, is actually responsive than most countries in ASEAN. I'm proud to say. As someone involved in policy development, we need to also be careful in choosing our way forward as we look for a perfect policy and framework, no? Because a perfect policy and framework, there's always a danger, no? When we practice extremes, reality is almost always gray, no? And much needs to be done to examine the impact of what is happening now in Europe and in other countries like decriminalization, legalization, and any other policies practiced in other countries. Again, as I mentioned, have most assuredly both pros and cons. No? So the Colorado study on marijuana liberalization is a classic example of the harms and benefits of any sudden change in policy. I'd like to believe that in the Philippines, we'd like to learn from other countries as they pioneer uh, in their own addiction policies. For a country with limited resources, it's difficult to have that gung ho attitude and be more efficient. No, so we want to be extremely calculated and evidence based in everything we do, so as not to waste resources and attain maximum impact. So in the field of dangerous drugs, I'm hopeful that future policies and frameworks is actually headed towards the proper direction. And I thank NoBox and the organizers of this summit, no, for this discussion. It's also models and one way of learning from each other. And thank you, everyone. Let's discuss more later.
Thank you very much, Dr. Bench, for sharing your thoughts and insights and actually personal experience on the evolution of drug policy reform in the Philippines. I'd like to highlight that point, Doc Bench, on the vast range of realities for people who use drugs that you mentioned, and how we have an operational framework through Board Regulation Number 7, Series of 2019. And for sure, we will talk more about that space later.